Again, my name is Eric, and I'll be kind of one of your hosts here today, along with Patrick, as I'll bring him in here in just a moment. But today, as you'll see here on the screen, we're going to talk about the changes that are coming into 2015 that's actually going to help you launch your business in healthcare. My name is Eric. I'm the Research and Development Director here at ABS, and so some of the things that we found here recently, again, on some of those statistics, is some of the things that we're sharing with our current group of licensees. Also, let me go ahead and introduce you to our founder and CEO of our company, Patrick Phillips. Patrick is not only the founder and the CEO, he's also on the editorial board of Billing and Coding Advantage magazine. He's an author of several books, one that we're going to talk about today called Cash Crunch to Cash Flow. And we've got a lot of things to cover here, so I'm going to go ahead and bring Patrick on in. Patrick, let's get on here, and let's cover these topics that we want to cover for 2015.
Yeah, 2015 just happens to be, it's like a window, isn't it, of opportunity. You hear that all the time. This one is a window, isn't it, Eric? Because we got a lot of stuff that's happening that will help people who want to get into this business really launch their business faster than ever before.
And although there's some great windows of opportunity here with 2015, it will exceed, as we're talking about here, just 2015 and really and beyond, because this is just the foundation of how everything's going to be rolling out. So, and we'll get to some of those numbers today to kind of show what we're talking about here.
Yeah, so Eric, let's talk about what the doctors are facing. Our licensees help doctors in several ways. It just happens that in 2015, they're going to be facing some things that are critical to the success of their practice. We've seen doctors go out of practice and shut their practice down because they weren't able to handle some of these. In fact, the November issue of Reader's Digest, this is the cover of it right here. And as you can see, he says, "This job's tough. I need a hug." And I thought that was apropos to what we're talking about today, because doctors are just human beings. I know people think that they make a lot of money. Some of them do. If they're specialists, if they're surgeons, for example, they could make $300,000-$400,000 a year more. But the average physician today is down to around $160,000 net out of their practice. And so that's not a lot of money in today's dollars.
It isn't. And one of the articles that we're actually going to see today is a very recent article, I think it was December the 2nd, of the memoirs basically of a doctor that says, "Hey, I'm barely even making enough to even house my family and even educate them." So we're going to be talking about some of the big issues that these doctors are faced with, and one, as we can see here on the left-hand corner, is about EMRs, electronic medical records, the ICD-10s, which are coming up. Those has to do with the coding. Now, let's pause here for a second, because we don't want anybody to get lost here. You don't have to know coding to do medical billing, but we are here to help those doctors. We have the expertise. We have coders that can help you help those doctors. And then the other corner right there is how doctors are going to try to collect their money. They are so worried about how they're going to collect money. Patrick, I've been on several demos in the last couple of weeks talking to doctors, and it doesn't look really good for doctors going into 2015 with some of the things that we're going to be even sharing about today.
Well, that's the question we get from some people from time to time, and that is, are doctors all being absorbed by the hospitals and the larger groups out there? Are there going to be any individual doctors left for me to do the billing for? And
right.
The answer to that is yes. In fact, we've seen doctors go into working for hospitals and then leave the hospital and come back into private practice because they find out that they are basically just, employees. Their time is controlled by the hospital. Their income is controlled. That's not really why they went to medical school, to be an employee for somebody else.
Yeah, and I think there's an article that I even found here doing a little research for the webinar today, that although that there are doctors that are going in and they do think, hey, if I just become an employee of a hospital, that's actually costing them because they're not making their potential. And it's all because, Patrick, it just gets down to the fact that it seems to them to be somewhat complicated. and the demands that we're going to talk about first, just on the electronic medical record. So here are some things that we're going to talk about today that are going to, what we do here at ABS, help position our licensees, because I think, Patrick, people really want to know what's going to differentiate me out there in the marketplace to help get in front of these doctors. And I think hopefully one of the things that we'll talk about today is this particular area about the EMR system.
Yeah, electronic medical records is just something that the government, of course, is mandating that doctors get involved in. Not that the doctors want to get involved in it, but it's certainly the future because it will tie all the medical records together and allow doctors to share that information of a patient with other medical providers. So a very important part of the future here in America.
Hey, Patrick, real quickly, there's a question that's coming here from Pete. Pete's asking, don't all doctors already have an EMR system?
Well, that's an interesting question because I think we've got a chart coming up, don't we, Eric, talking about how many doctors really are involved already with an EMR. So
Yeah,
the short answer is no, they're not.
right. Yeah, let's talk about this article. This is the one I shared with you that truly has come out here lately. Why don't you kind of go over these little segments here? Certainly, you can see that this was a posting of back in December the 2nd. So this actually came out, just yesterday.
Yeah, it's by a journalist who said that he was glad that he, was in journalism because when he read this book that's out by Sandeep Jauhar called "Doctored: The Disillusionment of an American Physician," he convinced him that he made the right career choice. And one of the reasons is right here in this quote that you've got on the screen, Eric. It says, "For his effort, his empathy, and his desire to do good for his patients, Jahar was barely able to make a living wage." Now, folks, think about that. Here's a doctor who's written a book saying I couldn't even make a living wage and provide an adequate housing and education for my wife and children. Then it goes on to say he mostly describes hating the assembly line medicine that makes doctors little more than electronic medical record scribes with the power to instantly order tests and medicines, but no time to build relationships. They went to medical school to help patients. They wanted to get into medicine because it helps other human beings. And of course, if they're focused on just doing their billing in addition to running their practice, they don't have the time to build those relationships, do they? That's why you see the doctor, maybe 5 minutes.
Well, the reason I wanted to bring this up because you recently had an experience yourself that you went to a doctor and they just didn't seem like they're the relationship that we used to have with our doctors is because of they are so bogged down in their electronic medical records that and a lot of doctors' offices either have a laptop or they got some type of desktop that they're having to type this information in and not being able to build that relationship. And we've got a solution for that, as we'll show you here in just a moment. But that last quote there is really what we're talking about.
Yeah, that's about what happened to me. The doctor gives me about a 10-second greeting and then started typing on his computer the whole time. So it's just weird how that doctors don't really think of themselves like they should, and that is being ready to help a patient, make them feel like they really care about whatever health problems they have.
So here we got the issue. Doctors juggling between what they have to do in an EMR system and maintaining a relationship with their patients.
Yeah, and as this article shows that just came out, by the way, 2 days ago, it says by supporting digital health, electronic medical record systems, that's EMRs, to create collective savings of 78 billion over the next 5 years. So there's definitely a reason why doctors should be involved
Right.
with their own EMR or EHR. Those terms are kind of interchangeable in most cases, but they're not. And we've got, again, more charts to show that too.
Well, here's the issue. Doctors are forced to have an EMR system in place by the year or in the year 2015. So when
Yeah.
Patrick mentioned earlier that there's a window of opportunity, here it is. They have to have an EMR system working in 2015. But that kind of goes along with that question I mentioned about Pete earlier. Pete's asking about Don't all doctors already have EMR systems? My goodness, I go to my doctor. I've seen my doctor have an EMR system. So let's talk about the true reality of everything.
Oops, that one past that. There we go. Yeah, this is the Black Book ranking. I think it's just blackbookrankings.com, isn't it?
I
Source.
believe so.
Yeah. And as you can see, this chart is from the year 2006. Let me get my pen here. I'll show you this. 2006. And then it goes up through 2009, 12, and so forth. But look here. In 2014, folks, I'm sorry. Something happened there to my pen. 2014, only 81% of doctors have any kind of basic EMR, and only 50% have a fully functional electronic health record system. So that to me says that, well, to answer the question earlier, only half of them out there have anything that they've even put into place, implemented. This is those who've implemented. That means they've started to use it. Doesn't mean they're using it to its fullest
Right.
potential, of course.
And let's understand the difference between a basic EMR system and a fully functional EMR system. A basic EMR system is basically, again, there's an EMR system out there called Practice Fusion. It's a free EMR system out there. It's very basic. It only does a certain limited number of things. That's why the number seems a little high on that end, because again, it's a free EMR system. When we're talking about a fully functional EMR system, we're talking about really the things that are meeting the certain requirements for Medicare. And when a doctor sees a patient using an electronic medical record system, can they do their e-prescribing? Can they do the functionalities that they need to be able to do there? And then once they're through seeing that patient, does it transfer from that to the billing system seamlessly? So as you can see here, even as this is a recent survey here for 2014, only half of the doctors in America have a fully functional EHR system in their office and that they've at least implemented it. Now, the next slide that Patrick's going to show you is even more surprising. Percentage of utilizing. So this is the utilization of an EMR system. So you got half of doctors that are actually utilizing some type of fully functional. Out of that, now you're starting to see broken down into by state actually how many doctors are actually utilizing their systems.
Right.
On average, you're only talking about 30%.
Yeah. Which means, of course, that the doctors are not only getting the value out of them that they could, but there were some financial incentives in place from the government that the doctors are not taking advantage of if they're not fully utilizing a fully functional EHR. And of course, we're saying all this because the one that we have for you to offer to doctors is fully functional.
I just want to point out some of the bigger states. Let's just take the third column.
Yeah.
New York. New York, 16%, 16.7%. Texas, 16.6%. California, 14.9%.
Yeah.
I mean, those are staggering numbers. So again, answer the question: do doctors have an EMR system? A lot of them do. Are they actually using them? This shows you that they're not actually even using them.
Right. Which is important for our licensees because, again, that's that window of opportunity we're talking about for this coming year to be able to build a very solid, profitable, medical revenue management practice.
Exactly. So these are some of the issues. Now, Mark's asking the question, what stops the doctors from setting up these systems? Nothing's stopping the doctors from setting up any type of EMR system. Are they meeting the requirements, number one? Number two, is it easy to use? That's the second question that we usually get asked. And number three, does it really work with the billing system? So those are some key components there that what you'll find out, these are why a lot of these doctors are not using the system that they're currently on. So what does that tell you? There's a low amount of doctors that are actually using their EMR systems to their fullest functionality.
Yeah. All right, let's talk about that ICD, whatever that is, Eric, that's facing the doctors. Looks like it's rolling from 9 over to 10.
That's correct. Here in 2015, this is another window of opportunity that we can help you with in gaining doctors. Basically, what we're showing you on the screen right now is what's called a super bill. Uh, on that super bill or encounter form, as you can see here, is it being blown up a little bit for you? There are codes on here, and the codes that you see kind of sort of in the middle there, like, or let's just take that last column over there where it says bronchitis. I think everybody understands what bronchitis is. And out beside that bronchitis, there is a little code there, 466.0. Well, folks, that code is about to be changed from that code, because this is the version 9 codes, to the version 10 codes. And what's going to happen is what that one code would take care of in one, that code is actually going to turn into either 6 to 8 different types of bronchitis issues. So what does that mean? There's going to be more codes for the doctor to have to learn. What we have available is a way to make it even simpler for the doctors, because number one, we have coders that can help you to help these doctors learn their new medical codes. And if they use our electronic medical record system, the system in itself will tell them what new codes to use. That's what's incredible about our system.
Yeah, it's built in. So to answer the question we get a lot, of course, is how much do I have to know about all these codes? Well, our system has all the codes built in, so you don't have to know any of them. In fact, the doctor is the one that needs to be worried about these new codes, since there'll be what, Eric, what'd you say, 8 or 10 times as many codes next year,
Right.
Starting October 1st. They're the ones that are going to be swamped with trying to get up to speed on these. Well, our electronic medical record system already has them all built in, and that makes it very easy for a doctor to transition from one to the next.
Yeah. So again, reiterating, you don't have to know anything about codes. We've got that actually covered for you. That's one of the services that you can actually use. Now, Patrick, we shared this article not too long ago. I mean, this is an article back from October, and people can go see the web address down there at the bottom. But let's pinpoint some of these things. These are 7 steps for helping physicians get ready for the ICD-10. So let's kind of take a look a little bit deeper into what this lady's saying.
Yeah, she says that small physician practices are struggling with transition to electronic health records, meaningful use, reductions in revenue, and increased scrutiny by the insurance carriers, including Medicare and Medicaid. Physicians have consistently struggled with managing patient care while also addressing all of these administrative burdens. Isn't the focus of good medical care supposed to be the patient? Eric,
Right.
you're the one that told me this several months ago. You said, Patrick, think about it. Doctors are in 2 businesses: the
Right.
business of getting patients well and the business of collecting the money for helping the patients.
Yeah. I mean, and if you can demonstrate with our help, because we'll actually do a demonstration to the doctors and showing them how we can help them. If you can demonstrate, the doctors are very eager to get that billing out of their office.
Yes. And then this lady goes on to say, physicians are frustrated that the patient is no longer the sole center of attention. We talked about that earlier. A physician goes to medical school to help patients and manage their care. And now that seems to have taken a backseat to all of these other issues. No wonder they're hanging back and not spending the necessary time to get ready for ICD-10. It's not their top priority.
And I'm telling you, it will become a top priority within 6 months of the date, what's coming up, which is October of 2015. So, folks, I mean, close right after the first of the year, you're going to find a lot of doctors kind of scrambling, because this is actually going to be a big issue coming down for those doctors here very, very shortly.
Yeah.
Okay, and Patrick, I think you brought this one. Go ahead.
Now we're at the worried doctor here. He's looking at all of his bills. He's wondering, where's the money? And of course, doctors do have money coming in. They probably just don't know how little of it they're getting compared to what they could be getting had they had somebody who was trained to collect that money.
Right. I mean, it's amazing that doctors, there's been a reduction in reimbursement fees from Medicare. Um, there's been a whole lot of administrative issues that the doctors have had to go through this last year. And going into 2015, they're still faced with those issues.
Yeah, and here's a doctor that was actually interviewed in U.S. News Magazine, and he says that it cost him about, with all the different, between the person, that bills, that's his employee, the computer system with all the upgrades and codes and so forth, and then the ongoing IT support for all of his computer stuff, it cost him about $20 per claim. And Eric, that is an important number there. Oh, I keep pushing something here that I don't know what that means. Oh no, sorry. I'm trying to get back here.
There you
There
go.
we go. I think I was trying to use this little drawing program here it's not working for me. Oh,
All right, so we've got doctors that are faced with a lot of administrative costs. That's why I mentioned earlier that doctors, if we can demonstrate to the doctors, and we can actually do that not only in a demonstration online, but more importantly, we can demonstrate what it's actually costing the doctor to do medical billing in their own office. And I think that's one of the other questions that we get a lot of, Patrick, is if a doctor is already doing medical billing in their office, why would they even use me? And folks, we can literally demonstrate on paper, on black and white, showing the doctors what it actually costs them.
some of them wouldn't even believe it if we quoted something like this from Health um, Management Technology magazine. They say that it can cost up to $57 per claim. And some claims are not much more than that for the doctor. So the reason that they're not netting what they used to net, as I mentioned earlier, is because they literally do not have any idea as to what their overhead costs are behind the scenes. If you ask a doctor, Eric, just off the cuff, who didn't really pay attention to all this stuff, what do you think it cost you to file a claim? One of your people to file a claim inside your own office? Do you think they would even come close to that number?
No, what they're going to say, oh, it's costing me 2 or 3%.
Yeah,
That's what they think.
yeah,
Uh,
right.
but they haven't taken consideration of what they're actually paying an employee, plus all their taxes that go along with that, plus their vacation, plus just now, let's start adding some other costs in there. The cost of the system, the cost of their clearinghouse fees, the cost of this, that, and the other. Once you add all that up, that's where you're going to get those numbers at 50 something bucks.
And then they don't have any idea as to how many of those claims are actually being rejected by the insurance companies. Look
Right.
at this quote from the American Academy of Professional Coders. They found that the average number of rejected claims from medical practices averages around 34%. Eric, that's 1 out of 3 that are just completely, the money is just laying on the table and the doctor didn't even know that it's there. We know that. We've seen that here recently, haven't we?
Right. And so you think about it. You, everybody that's on the call today, everybody's going to be listening to us. You're an entrepreneur. When you send out an invoice, you want to get paid 100% on that invoice.
Right.
You would not put up with anybody paying you only 76%.
Right. Or
No, 67%.
yeah.
Yeah, 67% of what you billed them. Just imagine that you send out a bill for $100 and the person says, I'm only going to pay you $67.
Yeah. Unheard of.
Yeah, you just don't, you're not going to get that.
And look at this from the New England Journal of Medicine. Market analysts estimate that 24 cents out of every dollar are wasted on the administrative and billing expenses. So not only are they not collecting the amount that they should be collecting, uh, it's actually costing them 24 cents out of every dollar. Well, Eric, if I've done my math correctly, that's 24% of their costs, right? 24% of all the dollars that they bring in, 24%. Now, our licensees, of course, nationwide, we know that you do charge a percentage of the money that's collected for the doctor, but it's not near 24%, is it?
No. As a matter of fact, it's going to be averaging about 6%. And it's kind of funny that whenever sometimes when I've heard some of our licensees, and they quote properly, I mean, they may even say, doctor, I'm going to charge you 7%, 8%. And the doctors, they go, oh my goodness, that's so expensive.
Yeah.
Folks, whenever we can demonstrate to them, even showing them that at what would be on the high end of doing medical billing at maybe 7 or 8%, and we analyze that with what they're currently spending on their medical billing, they're going to find out that they're spending way more than 8%.
Well, here's an actual example that I just got this morning by email from our support department, Eric. We blocked out the information up there, of course, about the doctor themselves, but this is based on a real practice analysis that one of our licensees did for this practice. And as you can see, they were doing about 4,000 claims a month, averaging about $84 a claim. Look at their rejection rate.
72%.
Yeah. And so when we figure in the cost of what it took their own people to do the billing, they're in the office and so forth, they're only bringing in about $87,000 in that practice each month. Well, we, by doing the calculations on this and by getting their rejection rate down to 2% or less, that's what our nationwide average is at least, we could potentially bring in $235,000 a month. Now, that's based on 7%, by the way, the cost here, the 23,000. So even at 7%, this licensee is making $23,000 a month, but increasing the doctor's revenue, by $235,000.
That's amazing. And I mean, you can see the revenue increase of 248%. That's really, really on the high end. Normally, what we see in these practice revenue reports, and this is one of those things that we were mentioning earlier, is that in the revenue increase down there at the very bottom, what we see on average is about anywhere from 30 to 40% of an increase.
Right.
Just that alone is pretty high on most cases, but this one is because they have such a high rejection rate.
Yeah.
Huge, just amazing.
Not typical. That is not average. You're right, Eric. But it's unbelievable how high we do see some of them come in, 50, 60,
Exactly.
70%. Yeah.
Unbelievable.
So again, for our licensees, people who are getting into this business, American Business Systems has the solutions that the doctors need in 2015 and beyond. And you're looking at an illustration of some of the services that you can offer to doctors through ABS. So Eric, let's go into some of those and tell them what each one of those has.
Yeah, absolutely. And as we're doing that, we're demonstrating on the screen to you right now the simplicity of the system in and of itself. As you can see up in your left-hand corner right there, this is a demonstration that a patient can go online, fill in all their information, including all the symptoms of why they're coming in today. So if I'm coming in because I've got a sore throat, I can literally do that all online before I even leave the house, eliminating me from taking that pen and that clipboard and then filling all this stuff out just to hand it to somebody so that they can input it and then get it to the doctor. If I have the opportunity to do it at home, I don't have to touch anybody else's cooties, so to say.
All right.
I can do all of that at home and put all that information in it. And you can see this line we've got going directly from.
Is that my phone, Eric? That's really loud. I guess because it's on the desk there.
To the doctor there. So you can see how that information is going to go directly from the patient to the doctor. From there, the doctor will see the patient. And Patrick, I think we can click on the button there and get it to the next portion of it. That's where you, as the medical billing company, will actually retrieve it. Now, this is showing just a very simplified version of how everything's working, because what we're showing you here is that everything is integrated. You don't have to go get a third-party patient portal or a third-party EMR system, as you can see down there at the bottom, and you're not working with a third-party billing system or clearinghouse. Everything is integrated, so everything's working together here, working seamlessly together. So once the doctor gets through seeing that patient, all that information gets dumped in on your side for you to actually do the billing. Once you retrieve all that information, which is in this usually the same day, you're able to, on the same day, send out all of those claims through the clearinghouse to the insurance companies.
Now, let me
From
let me
there,
just briefly tell people about a clearinghouse.
yep,
That's usually a third-party entity, a company that's been set up to take the claims information from doctors and medical billing companies. They look at it, they scrub it, that is, they clean it up, and they reformat it the way each one of the insurance companies wants to see that data. Then they forward that on to the insurance companies. Now, in our case, our system has the clearinghouse built into it. We don't trust that to any other third party. This is why our rejection rate is less than 2%, and we forward it on.
exactly. And then one thing after they get that, we're imagine that on average, Patrick, we know that from the time that a doctor will see a patient to when they get paid from the insurance companies is about 45 days.
Right,
Because we're working in such a seamless format here, and the patient can put their information in, which goes directly to the doctor. The doctor gets through seeing the patient. That information goes directly into the iClaim portion of it here with the clearinghouse. We can ship out that payment, that claim today, and on average get those insurance companies to pay the doctor within 10 to 14 days.
right. And we've seen it as little as the same week. Sent on
Exactly.
Monday, and the doctor had the money on Friday. So,
So this is one of the ways and reasons that we want to help you as a potential licensee know that we can literally demonstrate what we've just shown you on in a live demonstration to those doctors, really how that all that works.
hey,
And so,
Eric, I see several questions coming in. So let me just address one here real quickly. Looks like it's from Ahmed. How much time do I need to spend to keep myself or my staff updated to the new laws? Well, the great thing about being a part of American Business Systems is you log into our private website for our licensees, and we will keep you updated. We will give you the latest news and updates and links, and we do webinars for licensees on a regular basis to keep you updated. We just did one recently on ICD-10 that was
yes,
done for us by a medical doctor.
exactly. So that's great, Ahmed. That you want to know how are you going to stay up to date? Again, like Patrick said, we do weekly, sometimes bi-weekly webinars just for our licensees, especially if there's something new coming along.
Well, let's talk about iClaim specifically because I'm sure all these names don't mean a lot to brand new people, but we've kind of broken it down here for you so you can see that iClaim is the little brochure on the left. That's a flyer that we have that you can put your name and logo on. That is the actual billing system itself. That's the one that actually does the processing of the claims. You're doing that from your computer connected to the internet anywhere in the world.
Exactly. And so, again, this is a lot of people will sometimes ask, well, will the doctor have to change their billing platform? And the answer is you want them to because of what we just demonstrated to you just a moment ago, because we own the own clearinghouse. That's going to help you win your doctors. Patrick, with that, a lot of people certainly ask, well, is that going to be a big hill to climb to get those doctors to get changed over? And it's really not. We really make that transition easy, very easy. So understand this, the iClaim platform is what's called a practice management system. And this means that simultaneously that doctor's office will be working in there, putting in all the patients and the filling in their schedule for that particular doctor. You, as a medical billing company, will be using that same platform to do the billing from, and you'll have complete control access to give certain requirements, let certain people get into certain areas of the software. So this system is a complete practice management system for you.
And then on the back end, you can give access to the doctors with the electronic medical record system. We call it EMRX. That allows the doctor to actually utilize that when he or she are seeing the patient. Now, we're illustrating it here on a computer screen, which it could be run from a computer screen, but most doctors are using iPads now for this, aren't they, Eric?
That is correct. All those buttons are big touch buttons just to go right through. Again, we want to eliminate a doctor having to go to a desktop. That doctor can sit there with their iPad right in front of you, keep eye contact with their patient, and go through the whole diagnosis with that particular patient, and then one more click of a button, all that information goes over to the billing side.
Right. So it makes your job a lot easier. You don't have to input everything because the doctor is actually doing that for you on his or her end.
And you can see there that all the codes are built in there. So that's what Patrick was kind of showing you there, that the doctor is responsible for the code. So the doctor will hit one of those buttons, it will automatically log it into that particular visit, and those codes gets done over, put on the iClaim side for you to do the billing.
Yeah, in fact, it happens that that screenshot we've got there, Eric, it's kind of hard to see, I know, but there's an ICD-9 and then there's the ICD-10, as you see, already next to it. So again, ours is already ready for ICD-10. It's been ready for several months now, and
Right.
even though the deadline is not until October 1st of 2015.
Before you move on, Rashawn is asking who trains the office if they decide to go with the system. Great question. We actually have lots of training modules that they can review. There are recorded webinars that have already been out there that will actually train them. Plus, there are, I don't know, 10 or 12 different live webinars that happens throughout the week that they can jump on, learn other parts of the system. So there's a whole implementation schedule that will help them, that office, get trained for that.
Yes, you can get as involved in that as you want to, but of course, that's part of why we're here behind the scenes. Our staff and our technology partners help those doctors and their staff get up to speed on the system.
And Astrid's asking, does this eliminate the super bill? It certainly does.
Yes, it does. There is no paper involved in this business. It's totally electronic, so you don't have any papers coming from the doctor. It's all done online through a system that will just allow you to see exactly what the doctor has dropped into the system for you. This is an interesting quote, Eric, talking about collecting money. The insurance companies are not the only ones who don't seem to pay like they should. This was a study done by McKinsey and Company, and they found that physicians typically collect only about 50% of the outstanding patient balances. That's
Well,
60
that could
billion
be
in bad
trouble.
debt.
Patrick, you would be surprised how often that some doctors don't even collect the copays, and then they have to go try to chase the money. You know as well as I do that when you try to go chase the money, it's going to keep eluding you further and further as it goes along.
Medical bills don't seem to be the ones that people instantly pay when they come in the mail.
No, that they'll pay their cable bill
Oh, sure, yeah.
before they pay the
No
doctor.
cable. And so
But
we have a system that's an online system, folks, that allows the patient to handle their own payments in their own way. It's a wonderful system. You can ask more about it and go to our virtual brochure that Eric told you about earlier to learn more about this. But it's called Choice Pay, and it's a tremendous way for the doctor to increase his revenue tremendously. From that 50% that he's now collecting, we can get that up to 98%.
right. And again, I think we all know, Patrick, that deductibles have increased, and so really this helps the doctor assist the patient in helping paying out those bigger deductibles. This is a great position for that. Now, everybody's seen a doctor's office with all this paper.
Yeah, you can walk down the hallways of some of them and see those boxes just stacked around because they're running out of room. They don't know what to do with it all. And that real estate is very expensive. So we have the solution for that too, don't we, Eric?
Exactly. It's called iDocs Now. Now, this is not to be confused with electronic medical records. The EMR system has to do with medical records of actively information that's going on with that particular patient. But moving from paper to electronics, the doctors still have to keep up with paper in their office, whether it's actual medical records or any other types of documents. Patrick, you're very good at discussing all the different types of documents that a doctor may have in their office.
Yeah, it's not just patient records, but his own personal records that have to do with the practice, his personnel records, his payroll records, anything that's a legal document. All of this can be stored now electronically in what we call an electronic online document management system. We call it iDocs now. And it's a great system because with a little scanner that you can put in the doctor's office, they literally can just stack in the papers and push a button and it goes up into the cloud where this document is now secured, HIPAA compliant security, and backed up with redundant servers and that type of thing, of course. And it's also available to the doctor anytime from any device that's connected to the internet. So he can access those patient records now on his iPhone.
Yeah, and I tell you, here's the nice thing about this particular service is that it's not just limited to doctors. So a lot of our licensees have actually used this with attorneys and with schools and other things like that. So you can see a little bit here that you can go beyond just the medical field. You can this particular service can be used for great many other types of businesses as well.
Oh yeah, any business that's inundated with paperwork, financial institutions, educational institutions, they all need iDocs now. So it does broaden your market considerably out there. All right, Eric, I'm just kind of moving on through here because we're quarter till here. So this one's an interesting quote here. The average physician could increase their monthly billing by about 30% if their medical coding was just done accurately. That's hard to believe
Again,
that doctors are, even though they're in charge of the codes and need to tell you what codes to put into the system, because they don't have a good system that has the codes built in like we do, they're undercoding, aren't they?
they are, and again, going into this next year, they're going to need a lot of help with their coding. And the good thing about it is that we have solutions for two different types of coding issues. One is for doctors that are maybe being audited by Medicare. You're going to find a lot of doctors that are going to be audited by Medicare, but not only audited by Medicare, they're going to be audited by the corporate insurances. So at any given time, a doctor may be under, oh man, 2 or 3 or 4 audits at a time. What we can do with Audit Guard is use our coders to help those doctors make sure that they stay within compliance and reduce any of those errors that they may have or may be experiencing. So think of it this way. That's more preventative maintenance if you want to think about it. That's certainly a good way to open the door to some of the doctors there. CodeWrite, on the other hand, can literally help increase the doctor's reimbursements. As you can see there, up to 30%. We've actually seen it higher than that because the doctors are afraid to overcode lest it puts them in an audit.
Right.
So you can see how both of these kind of work together. They're two separate services that you can offer.
Okay, so the great thing is that you don't have to know anything about this. We have certified medical coders on staff that can handle all this for you. These are services, folks, that you offer that our coders actually provide to the doctors. You're making money, of course, like a commission on each one of these. So it's literally what I call mailbox money, Eric. The licensee only makes the connection with the doctor, and then the service is provided by our coders. The great thing is that can go on for a long, long time, month after month after month, as the doctor continues to use those services. So it's a good residual income. And these are what we think of sometimes as door openers. In other words, sometimes the doctor's office might not be ready to talk to you about outsourcing their billing, or maybe they already have and they're happy. But you've got ways to get in the door with these other services that once you're in, you're their friend. And if something comes up to where they want to change billers or outsource their billing, hopefully you're the one that's stayed in contact with them and they think of for that.
Well, here's a little tidbit there. You know, you could certainly ask any doctor, are you ready for the new ICD-10 codes? And if they're not, you could certainly be able to say, you know what, I have a solution for that.
All right.
I can help you with that. And again, it's because as we're showing here at ABS, we have the right tools for you to be able to go out and get those clients.
Yeah, we've spent thousands of dollars, literally, folks, on developing these professionally designed marketing materials. This one, for example, is the presentation folder that you put your proposal in and some of your flyers to take to the doctor. All the flyers are, of course, professionally designed and proven that they actually work. This is the book that Eric mentioned earlier that I authored that's on the cash crunch to cash flow in a doctor's office. We take them from cash crunch to cash
Mhm.
flow. And it's actually a paperback book that you'll be able to buy from us for only $3 or $4. It's on Amazon for I think $14.95. But the great thing is it's an educational tool for the doctor, and it points him back to you, the person who gave the book to him, so that he can educate himself and then come to you and say, "Hey, help me."
And then there are testimonial videos of doctors that are actually using ABS licensees. And a lot of doctors want to know, well, do you have any references? And so part of your marketing package that you get with us, you're going to get these DVDs of why medical providers are outsourcing their medical billing, and so you're going to get to hear them personally of what it has done for their practice. So again, we've got the right tools that we're going to put in your hands to help you get those doctors, and the ones that we've shown you so far are some of the ones that mixing these together to help you get that particular doctor. And you can see all of these are branded, and so that it keeps a very constant look about yourself. Patrick, I know a lot of people say, well, can I just go start medical billing on my own? Absolutely, you can. You can go start it today. But you're going to need a way to market your business, and this is one of the things that we have for you to help you, cut that time in half, if not even further than that.
Yeah, as you know, Eric, my wife Linda and I started our own medical billing company back in the late '80s, and that's how we got started in this business. We had to struggle and figure it out ourselves. Took us several years to figure out how to market to doctors, and so that's why we've put a lot of money and time into developing tools for our licensees, because that's the big question, right? If I get into
Right.
business, how do I get a client? Well, folks, that's what you're paying us our licensing fee for, is because we've developed the tools and the methodology that it takes to actually get past the gatekeeper to the doctor, educate the doctor in the right way so that they want to do business with you.
Yeah, and these are postcards, and a lot of people do ask, well, what about direct mail? I mean, those postcards are not necessarily for direct mail, but they're after you've made a somewhat of a little bit of connection with that doctor. What these are used for is just for what's, if some of you might understand this, for just drip marketing. And I tell you, Patrick, this is a very successful way of gaining those doctors' attention.
Yeah, we've seen that work many times for licensees. They sometimes call us up and say, "Oh, I just got a new doctor, but I was surprised that I hadn't even contacted them in several months, but I put them on the drip program that you have, the automatic auto card we call it, that sent out these cards, and they that kept my name in front of them. And so when something changed in the office, like the office manager finds another job for $1 more an hour or whatever, they think of you. You're at the top of their
Exactly.
mind." And
And
then there's
then what?
trade shows.
Yeah, trade shows are great, and we've got a booth ready for you to go. I mean, you just reserve this, we ship it to you, and I think this thing stays pretty busy throughout the year.
It does. And you know what, Eric? This is probably one of the best ways for somebody who likes this type of thing to market, because you're not going to your prospects. They're coming to you. They're walking up to your booth and wanting to know more about what you do.
Yeah, and some of the best things, and we've got it in this large size here. This is a pretty big size here. We also have a tabletop, and sometimes, Patrick, I think people will find out that there are little bitty, and they're not even trade shows. They're just little bitty gatherings that doctors attend. Maybe it's a training class or anything, and sometimes just for a few bucks, you can set up your display right as they're walking in the door, and you can get a lot of generation of traffic just by people just coming to you and being at some of the smaller events even.
Yeah, this display cost us about $5,000 to have developed and produced. And that's why, folks, when people ask us about our licensing fee, we tell them that includes everything. We've included all that development and these tools for you as our licensees because of the way we've modeled our company. We make a few pennies on each one of the transactions. So, of course, we want you to do lots of transactions and get lots of clients.
There you go. And then we have the right support. I think, Patrick, I think this has been a big thing that we've worked on over the last 4 to 5 years is really beefing up our support because we do want to support you. And, we're not successful unless you're successful.
Yeah, because after you've left our 1 week live training workshop here in the Fort Worth area, you get back home. How do you get your questions answered? How do you get the support that you need? Well, we haven't even touched on all the different ways we can support you, but folks, just trust me when I say that our licensees will tell you that we've done support right. We've done it the right way, and that is we give you all kinds of ways to access us through live chat, through toll-free phone numbers, through email, whatever it takes for you to get the support that you need. We're here for you in that. So, Eric, as we sum up here, I guess we could talk about these pieces of the puzzle that most people don't know how to put together. We've just figured it out over the last 20 years, uh,
All right.
including, of course, starting with the billing system itself.
Yeah, here we go. As Patrick's pulling this thing together here, you can see that we surely do have not only the right support, we have the right tools. And when you put all these pieces together, these are the solutions that a doctor needs. Certainly, it would cost them a lot of money to have a staff with the billing system, the EMR system, the clearinghouse, and the people. If they just had all of that in their office, that would cost them a lot of money because of the scalability of this particular business. You are able to get as many doctors as you think you can handle. I think on average, I think some of our licensees have anywhere from 6 to maybe 10, 5 to 10 doctors at a time that they like to do billing for. Some of them just stop there at 10, but we certainly know that some of them have grown to 25, 30, even over 100 doctors that they do billing for. But it's because that we brought all the pieces together and in a very systematic way to help you, number one, get your clients, get in front of those clients, and then provide them the service that is really second to none.
And part of that has to do with our private licensee support site that we've got a screenshot of here. Basically, you'll see it kind of go up there to the menu, and I'm pointing to the Get Started section. There are drop downs for every one of the tabs that you see there. And folks, there is a ton of information, recorded webinars, documents. We've got more than you can imagine, hours and hours of training on that support site there.
Exactly. And folks, the support that you're getting here just through the webinar that Patrick and I are sharing with you, these are a lot of the same things that we're going to be sharing with our licensees. We are going to have a licensee webinar here shortly on just the statistics that we showed you today. Because we want to not only encourage you, we want to also encourage our licensees. This is some new information that we found. So you actually got some of this information before we even got it out to our own licensees. So folks, there's a lot of business out there to be gotten.
Yeah, so that next workshop, besides the one that's filled up next week, of course, the next one we have is in 2015. It's the January the 19th to the 23rd. That's 8 to 5, Monday through Friday. You fly in on Friday, and we get you a little early on Friday so you can get home at a decent hour. But folks, this is a life-changing event. 1 week can change your life. We have a money-back guarantee on that, which a lot of people don't understand how we do this, but it's basically because we don't have a lot of people who even take advantage of it, because I think in 20 years we've only had 3 people ask for their money back. But it says very clearly that if at any time during that training workshop, for any reason, you don't think this business is right for you, just simply tell any staff member and they'll arrange for you to receive a full refund of your license fee. Now remember, folks, we couldn't be doing this and saying this if we didn't know that we have something very, very unique in the marketplace and that makes a lot of people very excited. Watch some of the testimonials on our blog that's out there. You can find that on our website there under news. Just look for the blog there and go watch some of those. You'll see there's dozens of testimonials from people who've been through the training, and you'll see that they're pretty excited at the end of that training.
And then as you keep doing your due diligence, one of the areas that you might want to do your due diligence in is just go out there on Amazon.com. You can go out there and find start your own medical billing claims billing service, this is from Entrepreneur Magazine. This is nothing that we had to do with, except that they did list us as a business opportunity. And so I think there were two that they listed, ours and another company that is no longer there. So we a lot of people do ask you, Patrick, and us, are you going to be around for a while, folks? We've been here for 20 years, and we got a pretty good track record. We've got a lot of very successful people that have been in the business, and so listen, we want you to keep doing your due diligence. Go back and look and review some of those old past webinars that we've done. I'm sure if we didn't get your question answered today, some of those are going to be there. And then follow us on Twitter for you guys that are really tech savvy. You want to follow us on Twitter. Anytime that we post some new things on our website or on our YouTube channel, that's where you're going to find us. And there's lots of information there as well.
And we have a YouTube channel. You can go out to youtube.com/whyabs and see lots and lots of videos out there as well. Well, Eric, we have the 2 more weeks in this month that we're going to do these webinars on Wednesdays, which we have been doing for the past 4 or 5 years. But we're going to move those up to the Tuesday before Christmas Eve and the Tuesday before New Year's Eve, and do those on the 23rd and 30th. We're just going to give you guys a heads up. We'll do that on the next webinar or two to kind of remind you of that.
Yeah, because some people may be on vacation, Patrick, and they may even you might be on here today and go, wow, I was going to have, I'd like to be on that. I'm really looking forward to learning as much as I can about this business. We'll be here, and we will certainly do these webinars. Patrick, this next one that we're going to do, I think is going to be is very important.
Yeah, there are a lot of scams, as you probably know, out on the internet. And so, I want to really point out to people why it is that you need to do your due diligence very carefully about any company that's out there. In fact, I'm going to put that link that you see at the bottom there in the chat part of GoToWebinar. So over on that little control panel, look for the chat. I just stuck it in there. And so we're going to go into step by step how to spot a scam and distinguish that from a legitimate business.